Dr. Brent Hulsebus, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is our podcast that we do for when people have questions about chiropractic or chiropractic care. All too often, people make the mistake of asking a family doctor whether or not they should go to a chiropractor, or maybe even orthopedic doctor. And the reason I say that's a mistake is because those two kind of doctors have very little, no education on what chiropractors do. So I'd kind of like be asking them, should I go see a dentist for this toothache? Again, they're not dentists, so why would you ask them? I would ask a dentist if I had a toothache. So people have questions about chiropractic or chiropractic care, how it works, and then whether or not they should be a good chiropractic patient. And I ask people to send me emails, chat with me in person, or send me a message, and then I come on here and ask the question. This week's question comes about whether I can still receive chiropractic care after surgical intervention. I've had surgery on my lower back previously before I ever met a chiropractor. Can I still go to a chiropractor? Or maybe I've got the C5, C6 in my neck fused. I never went to a chiropractor before. I had surgery before. Now I want to know if I can still go to a chiropractor. Well, sometimes talking to the surgeon about this isn't the worst idea. Sometimes I talk about you should always ask a chiropractor, but you could ask a surgeon. But the only question you should really ask the surgeon is, my surgery done? Am I healed? Is everything as solid as it can be? Because if everything's as solid as it can be and everything's healed up, now only the chiropractor would know whether or not you can receive chiropractic care. You see, when we go through chiropractic college, and I went to Palmer College of Chiropractic, and in my opinion, that's the best school. Well, it's the best school because it's the first school, and it's the biggest school in chiropractic. That all started there in Davenport, Iowa, at Palmer College. So I'm a Palmer graduate, third generation graduate of Palmer College. And you see, when we're at Palmer College, we learn something called the Palmer Package. And what's the Palmer Package? The Palmer Package is a bunch of different chiropractic techniques. We learn many different ways to adjust your spine depending on your needs and the patient itself and the situation we're in. When we go through learning the neck or the cervical spine, we learn so many different ways to adjust your cervical spine because everyone's different, everyone's unique. So if you came to see me and you've had interesting changes in your spine because maybe you've had a surgical intervention or something, there's definitely a way that we can change or adapt our adjusting technique around your surgery and still benefit you. Now, the vertebrae that have the surgery on them, we can't really do a lot with, right? They've been fused together. We're not going to be able to make them move independently again. That's not a realistic thing that can happen. But what we can do as chiropractors is we can adjust the ones above and below to try to help out. Now, will you get the full relief that a chiropractic patient without surgery ever have? Probably not, because you've had the surgical intervention. But can you live a better, healthier life after getting adjusted by a chiropractor, even though you've had these vertebrae fused? Absolutely. Matter of fact, I have a couple of patients who have most of their entire neck fused, and they're miserable. They had C5, C6 fused, and after a couple of months or some time went by, they started having more problems, so they fused more vertebrae, and they went back, had more problems, fused more vertebrae. And the patients started realizing that we're doing the same thing and we're expecting different results, and there's a term for that. So they decided to stop having their neck fused anymore, and they wanted to try something new. And so they came to saw me, and as a chiropractor, I was able to change my technique, adapt the way I adjust them because they've had surgery in the past. And I'm very happy to say, even though they've been all over the country seeing all different kinds of specialists, we were able to adjust their neck and get them a tremendous amount of relief. So if you've had surgery, you absolutely can still see a chiropractor. Now, another common surgery they do is they kind of go in and they clean out what we call the IVF. The IVF is the intervertebral foramen. And what that is on the backside of your spine. Everyone knows you have a spinous that sticks out. That's the bumps you feel when you rub someone's back. But about midway between that spinous and the vertebrae, the big bone that you've seen so many times, there's a little hole that comes on the side. Now, it's made up of two vertebrae. The top of the hole is made up of the bottom of the top bone, and the bottom of the hole is made up the top of the bottom bone. That's kind of confusing. If we have a diagram, I'll show it to you here real quick so you can kind of get a better idea. But the bottom line is here. I'll show you right here. So there's the hole right here where the nerve comes out. If you're watching me on YouTube or Facebook right now, you can, or LinkedIn or my website, you can see this. There's a little hole right here. The nerve comes out the side. It comes out behind the body, before what they call the facet joints. And now, if you've listened to my podcast previously, you know I talk a lot about these facet joints and how important they are. But right there, the nerve comes out. A lot of times what they do is they take that hole, like it looks like usually like a football or kidney bean shape, What they do is they go in there and they take, like I call it like a rotor-rooter. They go in there and they kind of shave off the things that are growing in that hole that make up that compromise, that hole where the nerve's coming out. They often call it a pinched nerve, but if you listen to my podcast in the previous, you know it's not really pinched, because if it was pinched it'd be under paralysis. It's just under stress is what it's under. It's not so much pinched, it's just got a little stress hitting it. So they go in, they remove some of that stress and they suck it all out. That's usually microscopic surgery. So if you're like in the car and you're hearing radios about microscopic surgery, I know when I go to Chicago, I listen to AM 670 The Score sometimes, and they'll talk a little bit about microscopic laser surgery to help your spine. That's what they're talking about. So this wouldn't be a fusion. This is be cleaning out the joint. Now after they've gone in there and cleaned out that joint, can you go see a chiropractor? Well, that's why I'd like you to talk to your surgeon. I want your surgeon to tell you you're totally healed. Everything that we could have done for this joint has been done. It's healed up. You're good to go. So once you get that green light, then you're good to go with the chiropractor, and the chiropractor is good to adjust you now. See, we might be really experts on doing chiropractic adjustments, but we're not really experts on spinal surgery, because we're not spinal surgeons, just like the spinal surgeon's not an expert on chiropractic because they're not a chiropractor. So once the spinal surgeon says everything's healed up from the surgery, you should be good to go. Now you can come and see us. Now, can we go back and adjust that one? Absolutely, because that's pretty much what they're doing in there. Is either they're shaving off bone in some of the extreme cases, like little bony spurs, or they're most of the time they're cleaning up some disc. Now the discs are really resilient. They're mostly made up of water and fibrous tissues that just kind of hold that in like a shock absorber. So once you clean it out, it's fully capable of taking the force of a chiropractic adjustment. Now, the different techniques that we would use, we probably want to do a big rotational force in the lower back right after you got that set and healed up. We would find a different technique. Again, if you ask a doctor, should you go to a chiropractor after having the lower back discectomy or microscopic surgery, they'll probably tell you no, because they're going to assume that the chiropractor is going to use the most violent, aggressive, torquing adjustment there is. But the good news is most chiropractors aren't idiots. Most chiropractors are really well educated, and we wouldn't do that. Now, maybe if we don't like you, no, I'm just teasing. We would never do that to a patient. We're way trained, way beyond that. So a lot of times, for some reason, they just assume that chiropractors are one-dimensional. They can only do one thing, but we learn all different techniques. So if you were to spend a day with me, like many students do, you'll see that you might feel like I adjust you the same way every time you come in, and maybe I adjust your spouse or a family member the same way every time they come in. But you'll see the next family, I do things completely different, because they have different spines, they have different needs, they're different lifestyles, and their spines aren't the same as yours. So if you've had the surgery, can we still help you? Absolutely. Chiropractic are experts on figuring out how to take care of somebody after surgical intervention. So you have the couple surgeries there. You have the ones where they go in, they fuse it together. No problem where you adjust the ones above and below more, because also if you look at someone who's had two vertebrae fused together, a lot of times your arthritis can travel above and below where that surgery is, because that whole area becomes more immobile after the surgery, which leads to degeneration arthritis. And it's really hard just to stop degeneration arthritis from occurring. So what we have to do is we have to go in there and make it move again so it doesn't happen. So yes, we can definitely adjust you after a fusion. But if you've had the C5 and C6 fused, don't expect us to move the C5, C6 independently, because they are fused, and they are fused with titanium. And I've known some really big chiropractors over my years, even with the Palmer College with a former professional wrestler. And I don't think he's going to break the titanium in your neck. Even on a bad day, I don't think he's going to do that. So you're totally safe to see a chiropractor after having fusion. Again, most common fusions that I've seen as a chiropractor are C5, C6, and then we talk about some of the lower lumbars. The other type of surgery they do is the microscopic or discectomy stuff, where they kind of go in and shave off part of the area. You know, that area down there, we pretty much can chart. I want this fully here. We can just go back to adjusting you like we did before, pretty normally, as needed. It's again the chiropractor will determine whether or not you need it. Another one that does happen, though, sometimes is like if you have a infection in your spine, they might have to do a laminectomy, and that's where the little arch that comes in the back. They literally just cut that part off because it's been infected, it's dangerous, it's got to come out. And that's usually, like, if they don't get it out, you could become paralyzed from that point down. It's very, very serious, very, very life-threatening. Those are the surgeries that we have to rush to. Like if you come to my office and I suspect that, we're going to rush you there. And I've had a couple of patients over the years, that's exactly what we did. They came in, something wasn't adding up. They had a weird thing on their skin, so we got them out right away. They were able to have emergency laminectomy, and they chopped off the column on the back that makes the spinous, and the patient now lives happy. Not as much comfort as it used to be, but still lives pretty happy. So can we still adjust those ones? Well, no, those ones we don't adjust, because even the levers that we use to adjust you, they've been physically removed. Can we still adjust you above and below that one? Absolutely. So can you still go see a chiropractor? Absolutely, you can still go see a chiropractor. But we just don't touch that area. That area just gets left alone. Unfortunately, a lot of times this is the area where the arthritis degeneration starts to occur because of the emergency surgery. But, I would take that over being paralyzed. One gentleman I know had his whole neck, had to have it done from C3 down to C6, and if it wasn't done, he would have been paralyzed neck down for the rest of his life. So he had to take off, and we can't really adjust his neck too much anymore. Is that a big deal? Nope, it's not a big deal because he's not paralyzed. So those are the kind of things that chiropractors know. We don't have to be told those things. Often if a patient comes to me with a letter from the doctor letting me know it's okay to adjust them and take care of them after they've done the things they have, I usually send a letter back letting them know and it's okay for them to continue care. Also, after I've completed my care, because I feel like they don't know what they're talking about, and maybe I'll talk to them the same way, see how much it goes back and forth, how much it reciprocates. So I like to have fun. So there you go. Can you still go to the chiropractor if I had surgery? Doctor's going to go in and do one of the 3 different types of surgeries. Am I still safe to come in? And there's more surgeries I talked about too. There's the ones where the vertebrae slip forward and slip anterior, and they put a plate there to keep it coming backwards, called the spondylolisthesis. And those, yeah, we can definitely still work with those areas. Again, just like another fusion surgery. A lot of times we try to stop those surgeries from happening. A lot of times we can't. So if you have a question about chiropractic or chiropractic care, if you've had pre-medical surgical intervention, you want to make sure you find someone that knows what the surgery was. You want to have them address with you the surgery. I would not go to a chiropractor after I've had surgeries in my spine and have the chiropractor just brush over them. I'd like to have them to talk to me about them. Like here, we take full spine x-rays. If you've had fusion, we'll point the screws out to you. We'll talk to you about that. We'll tell you how we're going to change our technique based on the surgery. If you've had a laminectomy, we're going to tell you how we're not going to adjust those areas with any kind of manual force at all, about how we would adapt and change to that. And if you had the microscopic cleaning out of the vertebrae, we would talk about how we're going to take care of those, when we're going to adjust those, if we need to adjust those, and how often we would need to adjust those certain areas too. A lot of times it's good to let sleeping dogs lie if it's moving and bending. We don't talk about the areas above and below we want to work on too. So I want to go to a chiropractor after spinal surgery if the chiropractor didn't address the areas with me. So that would be a red flag to me if I went to a chiropractor and they failed to mention the surgeries or talk about the surgeries. So there you have it. Can I go to the chiropractor after surgery? Talk to your chiropractor. More than likely you can. All right, everybody. If you have a question for me, go ahead and leave me a comment below wherever you're listening to this or watching this. I'm sure I'll see it. If not, head over to my website, rockforddc.com, rockforddc.com, and there hit the contact us. Also there you'll see our blogs, all of our previous episodes. And if you're just listening to me, you wonder what I look like, I hope I don't disappoint. You can see all the videos there of me speaking too. All right, thanks everybody. We'll talk to you again next time. Bye-bye.